Amid an exponential rise in cases in Mumbai, the Brihanmumbai Municipal Corporation has issued guidelines for COVID-19 patients under home isolation. Here's all you need to know about the new guidelines. Home isolation will continue for at least 7 days from testing positive and will end after the patient does not report fever for 3 days in a row. There is no need for retesting after the home isolation period is over. Home isolation is applicable to COVID-19 patients who have been clinically assessed as mild or asymptomatic. Asymptomatic patients are those whose infection has been confirmed but who are not experiencing any symptoms and have oxygen saturation at room air of more than 93%. A caregiver, ideally someone who has completed COVID-19 vaccination, should be available to provide care on 24/7 basis at home. Patients suffering from immunocompromised status such as HIV patients, transplant recipients, those undergoing cancer therapy, etc. are not recommended for home isolation and shall only be allowed home isolation after proper evaluation by the treating medical officer or doctor. Home isolation shall not be applicable for pregnant women 2 weeks before the expected date of delivery. Senior citizens and those with comorbid conditions will only be allowed home isolation after proper evaluation by the treating medical officer or doctor. Also, patients eligible for home isolation but not having requisite facilities at their residence will be shifted to designated COVID care centers. High-risk contacts of COVID-19 patients will be home quarantined for 7 days. Asymptomatic low-risk contacts of infected individuals need not undergo COVID test. The patient should isolate from other household members and stay in a well-ventilated single room, preferably with an attached or separate toilet. The patient should stay away from elderly people, pregnant women, children, and persons with comorbidities within the household. The patient should avoid sharing household items, for example, dishes, drinking glasses, cups, eating utensils, towels, bedding, or other items with other people at home. The patient should wear a surgical mask at all times and change it in every 6 to 8 hours. He or she should wash hands as often thoroughly with soap and water or with alcohol-based hand sanitizer. If symptoms like cough or fever or difficulty in breathing appear, he or she should immediately inform the nearest health center.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.